For our final panel of the day, we'll hear about how transparency tools are helping employers and their employees control costs through innovative medication services, such as those provided by MedSavyy. Let's welcome to the stage our next panel. This is a great addition to our program. It was added at a somewhat last minute following a meeting out in Salt Lake City when I had the privilege of meeting Sean and hearing a little bit about his company. So I imagine you all will find it very fascinating too, and appreciate that you're all here.
Thank you so much, Katie. And thanks to the Chamber for having us. I was really delighted to hear Alexandra's statement. When we have competition, prices go down and quality goes up. And I think for all of us in our own industries and our own businesses, we've observed that. And certainly the challenge that we're trying to address in healthcare in terms of high costs is injecting some competition. So what I'd like to do today is to get really tactical and to share with you a little bit about MedSavyy, what we are in terms of a transparency service, and get tactical and specific on what are the challenges and opportunities in implementing such a service, and what are the results. So how does it work in real life, and how does it impact specific patients and specific employers? So my name is Sean Karbowicz. I'm the founder and GM of MedSavyy, and I would ask my fellow panelists to introduce themselves as well.
Perfect. Good afternoon. I realize we're the last group of the day, and we're probably holding you back from either a wonderful cocktail or recuperating from having cocktails early this morning, celebrating the Nationals. So thank you for bearing with us. But so I'm from Idaho. My primary role at Advanced Benefits is a benefit consultant specifically within cost containment. So when we're talking data to day, I totally geek out on all this information being shared. It gives me excitement and hope. Our role is to bend the cost of healthcare for our group. So I'm here representing the employers that are dealing with healthcare and finding transparency tools along the way.
And my name is Wissam Yunus. I'm a pharmacist, a clinical pharmacist that I work with clients, large administrative services, only large groups, clients of ours at Regions Blue Cross Blue Shield in Oregon.
Great, thank you. So by way of background, just because some of you might not yet be familiar with MedSavyy, I'll tell you a little bit about what it is. It's not a sales pitch, but just for context. So what MedSavyy is it's a medication marketplace, essentially, what we've created. So we grade the effectiveness of medications, how well they work for various conditions, and we show consumers a letter-graded result for a drug in the treatment of a condition, and we show their cost. So consumers can see their alternatives for a condition, how well they work, and what the costs are. So the hypothesis is, what happens when you take that information and put it in front of consumers? And so we'll talk a little bit more about that. But first I wanted to start with Courtney and talk a little bit about employers specifically, because we talk a lot within the industry about the patient and about the provider, et cetera, but employers are footing the bill at the end of the day, and they're concerned about costs. Can you talk a little bit about what employers are seeking when it comes to prescription benefits and what they're asking you for in terms of the type of product they want to purchase?
Sure. I'd say ultimately the primary concern is the rising cost of medications. From the plan's perspective, both obviously personally their reinsurance costs and those going up when we see 6-digit, 7-digit annual price tags on drugs. And then also making sure that their members can still access these medications. It's a bit ironic. I was getting emails today of a member, so we live up by Canada, right just shy of that. So I literally got an email from a member an employee, saying, hey, do you think I can still get my DME, my durable medical equipment, if I go north to Canada and buy my insulin? Because I can't afford it anymore. So that's a primary concern for the plan. Also, obviously, transparency, of course, which we're here all talking about. But I'd also say that engagement is a huge concern for the plan. So we have these amazing tools we get access to. We roll them out. Some have been amazing. Some have had a lot of uptick. But others, the plan now just added a fixed cost for a solution that they thought was going to work. Again, in theory and a hypothesis, but it doesn't. So the idea of engagement and how do we get members on board with using these tools when we talk about consumerism, because It's just awkward. It's awkward if you maybe are prescribed a drug and now you have transparency to have that conversation with your physician and say, hey, like, why didn't you look at this one? You know, it almost feels like from a member's perspective, you're maybe challenging the professional. It's awkward, but it's really easy to go negotiate with a car dealer to get a different, car price, or go to shop the different dealerships in the area, right? You can be a consumer in that. So medical, it's just a little bit different. But yeah, those are the primary concerns.
So you mentioned engagement, and it's interesting.
Yeah.
I was just speaking to a gastroenterologist, and we were going over some data, and he pointed out that among his patients, those who are engaged with their care seem to have better outcomes, and those that he can't reach, they're going to have worse outcomes. So, obviously cost of care, but certainly engagement leading to outcomes, right? I mean, employers are purchasing benefits because they want their employees to be healthier, right? Well, so I mean, from a health plan perspective, maybe you can talk a little bit about that too, because of the employers that you work with.
Right. When I go out to the employer groups and we provide them all the vendors like MedSavvy, and there's others like, MD Health, MD Live, and, they do purchase. I mean, these programs do have the ROI. They do save money, but if we don't have the members or the employees engaged, then there's really no value. But the engagement is really it's a shared approach. We can't just, have that fall on just the health plan or on just the employer or the vendor. We really need to work together to figure out a way to utilize all our resources on how to engage that member, and we all have a role. So, and we're very creative in doing that. It's employer specific. So depending, we have, national employers, local, depending on that employer, we really work with the HR representatives, stuff that I work with, and then account executives on how can we engage their specific membership, in these tools. We know they work, but if you don't have the people using them and making them, friendly and whatnot. But I think once they get used and, people get used to the idea and the value of them, you just need one person, just personally myself, I'm new to Regents and we have a new tool, MD Live. Never did telemedicine. I'm in the field and haven't done telemedicine. Once I used it, I used it like 3 or 4 times already. So I think once you do that, and then it takes out one person to share their story and how simple and convenient it's using. So I think it's going to take time, but yeah.
So how do you introduce an employer to some of these concepts? As you said, there's new services, new tools. Employers are used to buying benefits, and then you have vendors like MedSavvy coming to you. How do you introduce these additional ancillary services to employers, and what are they expecting out of them?
Sure. So what we've found, we've shifted our ways of how we roll out lots of these benefits. Right? If you've ever been at an employee meeting, you'll have the consultant show up and they'll talk about deductibles and out-of-pocket max and all these great tools you have to save money in your HSAs. Lots of people glaze over. We try and make it fun. And we realize telling them about every single tool that they might have access to, it's ineffective, right? So the member's only going to typically engage when it's pertinent to them. So what we found with solutions like MedSavvy is we actually get data on the back end where we know there's maybe an opportunity for the member that they're just not taking advantage of. So some of our partnerships are with physician groups, and we'll let them know that data, especially if they're in a value-based contract or gain share contract, they have a high interest in reviewing maybe the medications that they overlooked, or frankly, they just don't know that the formulary has a better benefit for this other medication that the member could explore beyond. So we found great benefit in partnering with physician groups as a result, and embedding it. Dr. Donna, I'm afraid to say your last name because I'm going to totally botch it. So Dr. Donna, you had mentioned the idea of streamlining it. In your world, you can't possibly pop into another platform and be successful in treating the person for the limited amount of time you have. So what we found is some of these groups, we've literally put it in the EMS systems with these physician partner groups where they click on the MedSavvy button, or actually, usually it's the MA or the nurse that is doing this after the interaction with the physician. So let's say it's a new medication prescribed. They review which ones may be appropriate, what grade is most effective for the medication or the condition being treated in MedSavvy, and then also the cost. So now you don't have that sticker shock or the abandonment rate at the pharmacy. 20-30% of drugs just don't go filled because maybe you don't want to spend that amount of money, or you can't. So that's really where we found success, is partnering with physicians. Outside of that, it's the one-offs. So it's literally myself, my team being on site with the members. And I walk in and we had a tenured employee who had just switched to an high deductible healthcare plan. And he's like, oh, I hear my RX benefit's gone. I'm like, whoa, like, let's talk about this. So I'm like, have you popped into MedSavvy? You have, RX coverage, it's just in a different way. So we popped into MedSavvy, found out his 2 medications that he normally paid like a $10 and $15 copay for these generics were actually only $3 and $4. And oh, by the way, we can pharmacy shop too, and he can walk across the street of their dealership, pop into Fred Meyer's and get his drugs for $7 a month. He's like, I'm actually saving money. And he loved this solution. So the one-offs are great. Physician-led is even better.
Thank you. So I worked for a health plan for a number of years and often thought the PBM and the health plan was kind of it for benefits. But then in working with you, we learned that there's other ancillary services. How important is it for your customers to sort of integrate their other offerings, on-site care clinics and others, integrating that into some sort of a single point of care, if you will, or a single point of access for their beneficiaries, for their employees?
Sure. Yeah, this is extremely important. So we, of course, have our PBM, the standard options, I would say, for a member to get their medications, but we have got creative. We have, our groups that want to look outside the box, and maybe this is where I'm going to sound like a nut job, but I'll start with maybe the more non-controversial options, but near-site, on-site clinics. What's great about that is when we bring those on board for our groups, is they have access to generic drugs for $10. They pop into their doc that's, it's covered, and then they can walk out with a $10 cash for usually what they're stocking it right through data, just seeing the most common prescription patterns for the zip code area, and that's what they stock and make available for the members. That's great. The patients love it. So then you move on to prescription, getting them internationally. So I brought up earlier the idea of this member wanting to drive up to Canada. Well, obviously we know the cost. There's a huge disparity, and that's another concern that employers have, is why? Why in the US is it so expensive for the same med that's across the border? So we do have groups that pursue that, and frankly, they're getting 50 to 75% less for these medications coming direct from the drug manufacturer that we obtain them here in the US. Again, this is where I feel like some of you might think I'm a whack job, but just telling you what's happening.
Well, I think it speaks to the fact that drug costs are high, and employers are having difficulty affording them, and they're making trade-offs of, how much benefit can I afford for my employees, and how can I think outside the box in order to provide some sort of a benefit.
Yeah, I'd say the other solution that gets creative. I don't know how many of you have looked at the idea of RX tourism. But we have plans that, this is the idea that it actually costs less to get on a plane, get a member on a plane, incentivize them with money. In the whole state of Utah, I would recommend Googling this. The whole state of Utah sends their public employees, if they volunteer in, to participate in this. So we've actually had members do it. I literally on Monday got off the phone with a member, I'm just, put yourself in this person's shoes. They weren't responding to my calls, just trying to tell them about this opportunity if they wanted to look into it. But then once we broke down, talked about it, it was actually they didn't want to fly. They thought, this sounds too good to be true. The reason they didn't want to fly was because they couldn't afford the cost to just have health care, or excuse me, not health care, but child care while they were gone for one night. They didn't want to miss out on work. So we kind of broke down that barrier. And this person, otherwise, it's on one of these life-changing drugs that treats their RA. So for them to feel better and now no longer pay for the medication, this is life-altering for them to save the $6,000 out of pocket that they're always paying every year. So we do get creative, and to me, it's exciting when someone can partake in that and save that much money.
So there's there are multiple pathways that an employer can take in addition to kind of traditional benefits. And so bringing all of those options forward to the member to help them make the decision is necessary. Wissam, from your perspective, how I heard Casey earlier say, the systems that are used for data gathering, transparency, et cetera, weren't really designed for that purpose. They're designed to pay claims in many cases. From your perspective, could you talk a little bit about the other complementary services to the health plan that you're working with and that you're seeing to kind of round out the offering for the consumer? Again, health plans were originally designed to pay claims, and now we're delivering much more care through health plans. Can you talk about some of those partnerships and the pros and cons of working with them?
Yeah. As a health plan, so we have a lot of data. We have medical claim data, pharmacy claim data. If you have a PBM that you collaborate with, we share that data as well. And we actually have a lot of clinical programs that we provide to our members. Medication adherence is a significant issue. And actually, we have a nice program that we have with our PBM that outreaches to members using that claim information. It targets those members pretty specifically, where we can, carve out, members that may not have a certain diagnosis and try to identify those patients to make sure that they take their medications. Again, if they're not taking their medications, they're not going to have, better outcomes. So, but there's limitations of what a health plan or a PBM can do with that data, and we're continuously looking outside, of our realm, and working with vendors and partners to supplement, those programs that aligns with our strategy to provide those services and, more consumer-friendly services. We're very well known with, for prior authorization and trying to guide our members to the most cost-effective therapy through evidence-based medicine and whatnot. But, tools like MedSavyy, which utilize that evidence and putting it in the hands of the consumer at the time that they are being prescribed that medicine is ideal. A health plan understands that. We don't have those tools, and it's not our business necessarily to develop those tools, so we're always looking to vendors and partnerships with our providers and tools like MedSavyy to supplement our costs. So that's not unusual. We have lots of vendors and tools that we work with that makes that easier for consumers. Now, the big issue now that we're dealing with, I think that was mentioned earlier talk, is that we have all these tools now, and consumers have to log into so many different apps. How do we pull that together where there's a single sign-on and everything's handy under a single app? And actually, we're working with a company right now that we're actually pulling in MedSavyy, pulling in telehealth medicine, having a customer service concierge so that the member has one app to access all that information. So I think we're getting there finally. It's a slow process. And again, then you throw in the barriers with HPI and those types of issues that we talked about earlier. So, but it's really an exciting time. So.
Great.
I'm hopeful.
Thank you. So let's go ahead and get to the results. We talked about some of the challenges and opportunities. So what are some of the results that customers are interested in? And you mentioned engagement specifically. We know that build it and they will come doesn't work, right? You have to let people know about it. They don't know what they don't know. Can you talk a little bit about some of the engagement strategies you've seen that are effective to raise awareness, and some of the boots on the ground techniques that you've seen really that raise awareness for employees?
Yeah, that's a trick, because every group's communication style is going to be different. What we do is try and leverage, we get to know the group, right? The client, the employer. How do you communicate? We have some that have private Facebook groups. We have others that do their weekly, monthly blogs, whatever it may be. Different places they post things. Email, you got to be careful with email though. I'm sure you guys have a ton stacking up in yours, and you're likely to swipe to the left and delete. So what we've really found is come from multiple angles. Being in person really helps. We have registration campaigns, which is great. You incentivize them or bring food. People love food, brings everyone together. So if you have that set up, then they'll come and sign up. Again, what I had mentioned earlier is where we find a lot of success. So is if we get it in the hands of the actual prescribing individual, and then they have the conversation with that member. I mean, that to me is the ultimate game changer on how we've boost communication for that, because it matters to that person in that moment.
Yeah, I just want to add that, it depends on the employer, but once we get the individual registered, I mean, the vendor has so many tools and engagement strategies, we just need to get them in the tool. We have a lot of campaigns that we work, I might have a large employer group that has, we look at their utilization, they have really high utilization in an unsafe area. If the members are registered, the employees are registered in the tool, we can work with MedSavyy to throw a campaign and outreach to those members, but it doesn't work if they're not registered. So I've seen employer groups, just like a $5, gift card, just to get them registered. And, they could register for everything all at once on Ragents.com because there's tools and services on that, along with the other tools that they have. Or just, I think, what do you call them? The raffles work really well. You don't have to spend a lot of money, but even if it's $50, but, just throw your name in there after you register. It's very simple. But actually, we saw like increases in registration just through these simple sales tactics and, marketing tactics that are used with other industries.
Wissam, can you talk a little bit about customer experience from the health plan perspective? So I used to oversee the prior authorization department, and I had my name go out on hundreds of thousands of denial letters. Yeah. And I never once, literally, and I never once got a thank you card. Can you talk a little bit about the health plan's perspective on creating that experience for the consumer and kind of what their perspective, what the health plan's perspective is on that?
Yeah, prior authorization is not a popular method to control cost of medications, and not just cost. We do put prior authorization on medications, to drive safety. But yeah, it's not an ideal situation because it's after the fact that the prescription has been written. The patient or the member is already at the pharmacy, or or even at the doctor's office, it's already been infused, and they realize that it's not paid for. So we understand that's not ideal. It is effective. It's not ideal. It's not consumer friendly, but it is effective because we do see that those costs, as much as possible, are contained. But we are looking to avoid that situation through, new tools where we can, provide that information in the hands of our providers and our consumers, where they can make those decisions, those evidence-based decisions on those drugs at the point of sale, or, before the prescription is even, while it's written, and have those conversations between the provider and the member. So yeah, there's pros and cons. I don't think prior authorization is going to go away anytime soon. That's not going to happen. However, we are seeing, and we actually do this. I just had a meeting the other day where we're reducing the number of prior authorizations or the number of drugs that require prior authorization, because unfortunately sometimes that drives to the wrong care and it actually increases costs in certain areas, and this bubble occurs. So yeah, that's, I think that it's known, the health plan understands it's not very consumer friendly, but it is a very strong method to control costs and safety.
So both you and Courtney said it's so important to get in front of prior authorization, in front of the prescription whenever possible. Right. But a couple weeks ago, ICER released a report describing the drug increases, price increases on medications that had no additional clinical benefit proven, right? So just price increases. So the medication marketplace changes. Even if the physician writes for the best drug at that time or the best value drug for that time, the prices can go up. Generics come out. Can you talk a little bit about, either of you, talk about the importance of communicating with those members, with those patients, with the employees, to let them know about new options that are available even after the prescription? I know, Wissam?
I could just quickly start on that. Is unfortunately, from a health plan standpoint, you have a formulary, and that formulary you have drugs on certain tiers. And if you're on a health saving or a high deductible health plan, you have to pay a deductible up front. You're feeling the effect of those price increases. Unfortunately, as a health plan, we can't really, right now we don't have the tools to provide that information except through our vendors like MedSavyy, where it's at your fingertips and you can see before you purchase a medication, is compare all the different insulins. Even though they're all in the formulary, there might be different prices of that drug. And if you're in that deductible phase, you might be paying more or less, depending on where you pick it up, what pharmacy you're picking it up, maybe even the day supply. If you pick up a 90-day supply versus a 30-day, it might even be cheaper because your unit cost might be even cheaper at that pharmacy. And if it's a preferred pharmacy, there's so many variables, especially for those high deductible plans and that health savings, health savings accounts that are really meaningful for members. Unfortunately, from a payer standpoint, we don't have those. We don't develop those types of tools. We have a simple formulary that it's covered, but how much you pay depending on where you're at in your benefit, in your deductible phases, makes a huge difference on members. And in actuality, we ended up adopting MedSavvy for all of our fully insured business, including Medicare, and we offer it to our ASO or self-funded groups. To purchase that, and we kind of have those value statements given our fully insured business usage. So,
yeah, we just, actually just had an instance where, or a campaign where insulin Lispro came out, authorized generic of Humalog, and so what we did was educate our members because what we could see in MedSavvy that individual save about $200 a month. Which is real money to the members, and then obviously also to the plan, right? Because they're going to spend less too. So we did a targeted campaign just letting people know of that option because what we know on the PBM level, it fell into the same tier or bucket. So if someone was on the PPO, they would never know that the other drug was a better choice, right? Or a better price. So from the plan side of things, that's great. From the members on the high deductible health plan, they're very grateful to know about that. And then also, I'd say that continued education, another one-off instance was a member who she could no longer afford the ADHD medication her son was on. So again, we popped into MedSavvy, and it's because the price was kind of going up, but she didn't know that there was another effective option. So we just compare treatments, and there were 3 other drugs that have been recently released that were about half the cost, $200 a month instead of $450. That she was able to then kind of print off that compare treatment and go have a discussion with the physician. So it's constant education. I mean, I don't, yeah.
So punchline, and then we'll have a question. So what kind of ROI are we seeing? Are you seeing groups that MedSavvy is paying for itself, or?
Yes, yeah. I mean, we get data on that. We get data on converted savings based on the the claims coming in, and what campaigns have gone out and how members are either switching or stopping maybe meds that they should only be on for 30, 60, 90 days. They're on too long. So we're seeing some of our groups, literally their ROI in the first year of the PEPMs they've paid is more than paid for the next 2 years, after that. So it's working, what we're finding in our self-funded groups, absolutely.
And I just want to add, you don't always necessarily want to reduce pharmacy cost. So, adherence, you're going to see an increase in pharmacy costs, and that's not necessarily a bad thing. What the most important thing to look at, and we're trying to educate our employers about this, is the total cost of care. So if you have medication adherence, I know these biologics are very expensive, but there are studies out there that show adherence to these biologics for rheumatoid arthritis and whatnot actually reduce the overall medical cost of these patients because they're not going to higher levels cost of care, in terms of seeing their physicians often are going to the emergency room or urgent care. So we have to be careful when we talk about, reducing pharmacy costs. We understand that drug costs are going up and they're inflating costs unnecessarily, but that's a different issue than, medication adherence and tools like MedSavvy, where sometimes they're on maybe inappropriate medications, but sometimes they're not on medications when they should be. And we see an increase in, so some of the reports that I see for some of our large employers, we're seeing an increase in pharmacy costs after the tool's been implemented. And what we're still working on is what is a total cost, do we save that employer group the total cost of care? And sometimes that takes years, right? It takes years to find, that's a prevention of a cardiovascular outcome, because they took their statin every day and they're adherent to it. That's a little bit harder to measure.
Thank you. Questions?
A great job you guys doing. I think I would have to agree that healthcare, you can't solve it one by yourself, and MD Live is actually, Randy Parker is great, and I see you guys partnering together actually make it easier. We all have the same problem, is that a solution, if it's not easy, accessible, no one tries it, and employers, actually public, needs to know so they can adapt more. One thing I have in mind, always thinking about, is in healthcare, you talk about population health, and while we're trying to solve the problem using less and less drugs, in healthcare is more about if there are no diseases, there will be no needs for drugs. So how have you thought about how to address the problems? I'm in the world of AI and diagnostics, so I'm all about uncovering disease early, because Advil is cheaper than heart disease blood thinner drugs. So this is where I'm coming from, and see what would you do, if you can leverage such a tool, maybe to push it out to the public, say, diagnose early, because I don't know the statistic, and I don't know how the prescription accuracy is by doctors. Sometimes they may not know the full pictures, right? Because they may not have the full history of EMR of a patient. And as well, they're really bombarded. They're really, really busy all the time. And sometimes they may prescribe something wrong, and maybe too late of a stage uncovering disease, and they are really stuck to prescribe the expensive drug. So back to the question, and how do you address something more upfront rather than trying to save the money of having compared with cheaper drugs?
Right.
Yeah, I'll take a stab at it, and we are out of time. I think, obviously, personalization, the physician is the informed intermediary, the physician is the one, or the prescriber, it could be a nurse practitioner, et cetera. But that's the person focused on the patient, on the consumer. My view is it's our job to make that conversation as easy as possible, provide the right information and distill it down to really focus on the pertinent information, the important information, to arm the physician and get out of the way. So that's my perspective. Now, there's digital therapeutics. There's other aspects of care that we can use to shape that information recommendation. But ultimately, at the end of the day, it's still the physician who's the quarterback and in charge.
Say just one fun insider. If you were to go and search within MedSavvy, like the conditions, say diabetes, there is no A-ranked drug. A-ranked is diet and exercise. So I think there's some, on the same wavelength right there with that.
Well, thank you very much. Don't get up.
Thank you, Sean, Courtney, and Wissam. That was a terrific way to end the day. We're thrilled that you were all able to join us today, and we want to extend a special thank you to our sponsors who helped make this program possible: Blue Cross Blue Shield Association, Pfizer, Aflac, Heal, and MedSavvy. As a reminder, a recording of this event will be available on the Chamber's website, along with a copy of the agenda and speaker biographies. Hope you all have a very happy Halloween, and that way you can get your exercise, but maybe nutrition will be lacking. And way to go, Nats. Thanks.